Well, thank you very much, Madam Speaker. And, hopefully the members of this House will begin to understand that talking and using meaningless words is not helpful to Canadians. And I'm not sure how exactly to make that point because it seems to be lost on many people who come here to attempt to do business. What we do know, Madam Speaker, very clearly, the system that we have, the healthcare system that we have, as mentioned very passionately by the former president of the Canadian Medical Association, is we have a system that's on the brink of collapse. And continuing to talk about, going on with these grand ideas and priorities is in no way, shape, or form going to operationalize any ideas in this country, which is really what we need. And I guess in the vernacular, Madam Speaker, that would be we need people who are actually going to do something. And many groups have made great ideas and pathways and roadmaps and priorities, etc. There's been talk about a lot of money that's going to be spent or has been spent or should be spent. And what do we have? We have a system that's actually no different. We know that after 8 years of this Liberal government, we have people waiting and waiting and waiting and waiting. And very sadly, Madam Speaker, the waiting is now waiting until they're dead. This is the ridiculous nature and the heartbreaking nature of a system that we in this House, and I'll put the blame squarely at the foot of this Liberal government after 8 years, that they have allowed to happen, of people literally dying in emergency rooms. And I guess, Madam Speaker, that is the point where we need to begin to consider how to operationalize those things and what sort of leadership the federal government needs to bear to change this system. I was fortunate enough to have worked in the healthcare system as a family doctor for 26 years. 4 of those years were serving our country in the military, and even way back then, we knew very, very clearly that there was a shortage of physicians. Part of the work that I was required to do as a physician was to go to other bases around this country so that other physicians could actually have a vacation. And that is a rotation that we did. And as I transitioned from my military life into a practice in Truro, Nova Scotia, Madam Speaker, it became very clear that changes are happening in our healthcare system. We have, of course, as we all know, an aging population, which is felt more acutely, perhaps, in the Atlantic provinces in Quebec than elsewhere in this country. But we also knew that there was a dwindling of resources available, both in terms of finance and health human resources. I had the privilege and opportunity since I've been here to be a part of the health human resource study that we did in the Standing Committee on Health, and I'm still not entirely sure. I think it's a decent study. I'm still not entirely sure that there's a pathway forward on how to operationalize the ideas. And I think that that's one of the things that makes me the saddest, is to understand the folks who I had the opportunity to work with and who continue to work in the system, as we might say, is that they are burnt out, they're tired, they're frustrated, they're angry, they're hurt. And how do we actually begin to change that? And if we don't look at the system as a whole and begin to look at ideas on how to change that and how to change it quickly, then we're going to continue down the same path. It doesn't really matter how much money we pour into this system, but until we focus on the people who are the greatest asset of the system. I heard my colleague from the Liberal side talking about data saves lives. I have to say that cuts right to my own heart to say that data saves lives. The people out there save lives. The doctors, the nurses out there who are working on the front lines in emergency rooms in small places across this entire country, they are the people who actually save lives. Does data help it? Sure it does. We've been talking about a data strategy since I can't even tell you when, since the Stone Age, and we still have no real data strategy. We can talk about it all we want, but until somebody has the courage to actually begin to operationalize that and work collaboratively with provincial governments, we're never actually going to get to the point where anything happens. And I think that is the For me, coming here for the last 18 months, it's the most frustrating thing is that when do things actually happen in the government? When do things actually get done? Who actually does the work? We can have priorities and ideas and that kind of stuff. And I'm not saying that the Liberal government doesn't have priorities and ideas, not to say that they don't put money towards things. There are things that I don't necessarily agree with. And I think the other thing is there's no work being done. When is something actually going to happen? When is Beau Blois, who is an emergency room physician in Truro, Nova Scotia, actually going to feel the difference in an operational sense of something that we're actually doing? We can, again, use all kinds of meaningless words and talk about things over and over and over again. But when that man, who also has a family and a business that he runs, who works very hard in our community, when is the operational rubber going to meet the road? When is something actually going to happen that's different? And until that point, we know that we are going to continue with a system that lets down Canadians and lets down Canadian healthcare workers. And for me, having been in that position, that is something that makes me very, very sad, because from a very personal perspective, Madam Speaker, I know that the people who are working in this system, they care deeply about their patients. They care deeply about doing a good job. They care very, very deeply about the system as well. They're aware of the difficulties in the system. They call every day with ideas and ways in which they believe that the system could actually be changed to make it better. And I think the shame of it all, Madam Speaker, is after 8 years of this Liberal government, all we get is more ideas and planning and priorities and meaningless talk that doesn't operationalize anything. Now, I know what's going to happen today. Somebody on that side of the House, Madam Speaker, is going to chirp me and say, well, it's a provincial government. You're talking about, jurisdictional issues. And guess what happens? Absolutely nothing. That's the sickest part of it all, is that we can talk about this till we're blue in the face, but until somebody actually does something that creates an opportunity for change and operationalizes something, nothing happens. And that leaves the emergency room doctor, Dr. Beau Blois, still doing what he's trying to do, even though the fact that he works very hard and works many, many hours in a multitude of different healthcare settings in my area. Another guy that I've worked with many years, Madam Speaker, Dr. Wayne Pickett. Wayne Pickett will work in 4 or 5 different emergency rooms around rural Nova Scotia. Why does he do it? He does it because there's a need. He has tremendous skills. He's a compassionate doctor, and I'd be happy to have him, if I needed the work, for him to work on me any day. But that being said, how do we change the life for the Dr. Wayne Picketts of the world? How do we change those things so that in an operational sense that we can actually see change on the ground, so that the Mary Smiths and the whatever other people we want to talk about, the Ednas of the world, how do they actually get care? How do they realize that, hey, I don't have a family doctor anymore, and I have a difficult time getting my prescriptions refilled? How do we also then, Madam Speaker, take virtual care and make it a reality? We've had conversations around virtual care, but if you go to the doctor, Madam Speaker, and all you do is see them on a screen and nobody's there to examine you, how do you actually know that what you've told the doctor is right is actually, the case? How do we rectify the fact that using virtual care is increasing significantly the amount of diagnostic imaging that needs to be done? And why is that? Well, because the doctor, instead of actually seeing you and examining you when you have a sore arm, says, I guess your arm is sore, that's unfortunate, let's get an x-ray done. Whereas if you have an experienced practitioner, Madam Speaker, someone could actually see you and examine you and then realize, well, maybe you don't actually need an x-ray done, you have another problem. So these are things that we're facing. When you think about it, we have an electronic medical record in Nova Scotia. And, I think this is worthwhile explaining, because I'm not entirely sure everybody understands how this might work. But if I have an electronic medical record in my office and I'm working in the emergency room and you're my patient, then I could actually look at your records. If I have an electronic medical record and somebody else comes, whose family physician has the same electronic medical record. In the emergency room, I can't look at their electronic medical record, Madam Speaker. It doesn't make any sense. So again, until we actually take these very, very practical problems and decide to make a difference, then all we're going to do is talk with meaningless words that fill up the Hansard here in the House of Commons, unfortunately. Those are some examples of very, very practical things. We now have systems in Nova Scotia. I'm not being particularly critical. I think we have a decent system in Nova Scotia. I know it's similar across the country, where people struggle getting their blood work done. It takes a long time to book an appointment. We now have a combination of systems that is difficult for seniors to access because it's computer-based. So how do we rectify those things? How do we help seniors in our communities that are struggling with that? So when we look at those things, then we know that there's significant issues, again, that need to be operationalized. And I realize that the default in this grand institution that we're in, the default is to say, well, that's a provincial issue. But if we don't actually have leadership here and begin to look at innovative ideas and how we tie them together from province to province, and if we have a crisis in this country, we know that it is possible to show significant federal leadership, which sadly does not happen. Madam Speaker, I'm going to shift gears just a little tiny bit here and talk about mental health, which sadly, you know, once again, I would suggest there's been a lot of talk about mental health and not much done about mental health. And we know that since the pandemic, 1 in 3 Canadians would suffer significantly with their mental health. We also know, Madam Speaker, that this Liberal government has put together studies which would suggest that 25% of Canadians not being able to access mental health care is a reasonable number. Now, I personally think that that should be 0. There shouldn't be anybody out there who struggles accessing mental health care. And still in this country, in my mind, the greatest country in the world, we allow that to happen. And that's a travesty. That's something that is absolutely unacceptable. And what is at the heart of that? Well, I think there's a few things at the heart of it. One is it is a reflection of the state of this country, and the sad state is that everything is broken. People feel defeated, they don't feel like they have hope, they don't feel like they have a future, and they don't feel like they have a voice. And when people feel like that, we have to reflect on how that makes us feel inside as a person. How does that make us value ourselves and our contributions, not just to our families, but to our country, to our communities? How do we invigorate people so that they can actually feel like they are contributing to this country, that they get that wonderful feedback so that they know, I actually did that? What are the other things in mental health, Madam Speaker, that are important? There's a few things. You know, certainly we've heard from counselors and psychotherapists to know that this Liberal government still is charging GST on their services, which is a burden. We know that it would be a very easy fix, Madam Speaker, to allow counselors and psychotherapists not to charge GST on their services, which would then allow access to a greater number of Canadians to those services that they so greatly deserve. Now, what about the mental health funding? Now, if there's the millions of people out there who are listening to what we're doing today, we know very clearly that in the 2021 platform of this Liberal government that they did say they were going to fund a Canada Mental Health Transfer up to the tune of $4.5 billion. And here we are, year after year goes by. We had the fall economic statement. There's another budget coming up. We'll talk about more money. And Madam Speaker, I have to mention this. You know, I was on the MAID committee, and they wanted to talk about funding. One of the members on the opposite side, I said, great, let's talk about funding. Where's the $4.5 billion with a B, $4.5 billion of the Canada Mental Health Transfer? The member opposite had the audacity to say it's been transferred, which everybody in this House knows that not a penny, not one penny, if they existed in this country, no money has been transferred under the Canada Mental Health Transfer. Madam Speaker, the sad thing is that member, and if it weren't so incredibly gut-wrenching, nauseatingly inappropriate, it would actually be funny, because that member said, Well, maybe we transferred it under another name. Under another name? What, you announce a $4.5 billion project and you want me to believe that you transferred that money under another name? Baloney. Baloney, baloney. Shameful, shameful, shameful. And to think now, here we are, and Canadians are suffering. I heard my colleague across the way say that he realized that Canadians were suffering with their mental health. If you've committed the money, why don't you just send it to the provinces? Allow them to do things. Now, what we'll hear from this government, strangely enough, Madam Speaker, and this is a strange thing, so I want to be clear with this. Because this government is going to tell, this Liberal government is going to tell Canadians that they don't want to transfer the money because they want the provinces to be accountable for it. This wasteful government, this wasteful Liberal government is holding back money that could help the mental health of Canadians because they want accountability. They waste money on everything every day, and they don't want to help people with mental health. I find that absolutely shockingly ridiculous that we could even hear this type of retort from my colleagues across the way. So, Madam Speaker, we've had 8 years of this Liberal government, and what do we have to show for it? Well, perhaps some statistics might be helpful. Wait times for specialists. So when you go to see your family doctor, Madam Speaker, and they realize that, wow, this is something that I can't take care of myself, they send you to a specialist. Specialist may recommend some treatment. That time, Madam Speaker, I don't know if you know the number or not, it is 6 months. That is the longest time that has been in 30 years. We also know, and this is perhaps even a sadder statistic, Madam Speaker, is that 5 million Canadians do not have access to primary care. Perhaps 130,000 in my own province of Nova Scotia. We also know that there are 1.228 million people waiting for procedures in Canada. We also know that when we look at diagnostic imaging, for folks out there who may not know what that means, it's CAT scans, it's MRIs, it's regular x-rays. We know that those wait times are the longest, again, that they've been forever. What also do we know? We know that we have drug shortage in this country, Madam Speaker. We brought Health Canada and the Minister even to Health Committee to talk about the shortages of pediatric ibuprofen and acetaminophen. And what answer did we get? Absolutely none. Oh, we're going to work on it. Maybe we'll get some in. But we know that when people go to their pharmacies, the cupboards are still bare. What else do we know? We know that there are critical drug shortages of every pediatric oral antibiotic that, if I were working as a family doctor, that I would prescribe for children with infections, with bacterial infections. We know that every one of them are short. As I said previously, we know that from the words of Dr. Catherine Smart, former Canadian Medical Association president, that we are in a system on the brink of collapse. What else do we know, Madam Speaker, after 8 years of this Liberal government? We know that, as I mentioned right off the top, and this is a sad, sad story, it's a sad state of affairs, that people are dying in emergencies around this country. Somebody died in my own riding in Amherst. Somebody died in the emergency room, a lady named Holtoff. And that's a sad state of affairs. There are no words to describe that. Those are things that should not be happening in Canada. We know, Madam Speaker, after 8 years of this Liberal government, that this Prime Minister refused to meet with premiers. He eventually met with them and gave them a package, said, here's your money, hit the road. And I don't want to hear any of your talk about this anymore. We know, Madam Speaker, that there's a significant crisis in this healthcare system. And we know it's right now borne on the backs of the folks that continue to work on it, folks that I've had the privilege and the opportunity to work with. And that we know that if we don't operationalize our ideas in this great House, that nothing's going to change. And that's the sad concern I have, Madam Speaker, that nothing's going to change, and we're going to continue down the same path that we are. We need to have great leadership in this country, and right now that we don't have that. And Madam Speaker, I'll end with an interesting take on it. You know, if you want a solution to health care, then elect a Conservative government. Thank you, Madam Speaker.